Hi, so my name is Joe Weaver, and I am a psychiatric nurse practitioner. And since March, early March, I have been seeing positive COVID patients up until now. And we'll continue into this crisis with COVID-19 is gone. I've had 4 negative COVID tests, thinking, oh my God, my throat or my throat, my nose, I have this and this. I never really got a fever, and I've always came back negative. I don't really consider myself a freak about germs. I do what I can, but I'm careful. So I just want to show you how I whip COVID patients right in my face. And I don't know if in psychiatry in the hospital, it's not in and out. You're talking to patients. Sometimes it's 40 minutes, coughing. So first thing we have to do is we have to have good hand hygiene. So it's right. You need soap and water. Alcohol is great. Those alcohol white. To use alcohol. I made this because all the hand sanitizers are out. How do I keep it in my car? I keep a little one in my pocket. And how do you do that? You make it. So I bought on Amazon some isopropyl alcohol. This is industrial grade. I believe is 90% alcohol. Dude, you can get to 70%. 75 is better. 90 is way better. What do you put in there? You put some aloe vera. Any aloe vera that you can find. If you can't find that, put some lotion in there. And you have to do hand washing. So gloves are important. You have to wear the right size. I use 2 gloves. Put them on. So taking them off is the most important thing with gloves. So when you touch the patient, and I had a patient today, and they're like, oh, can you adjust my bed? I'm not going to say, no, I'm psych. I'll call the nurse. That's not appropriate. So, of course, you have to get in his face. You have your mask, you have your shield on, but now my gloves are contaminated. So I have to really think. So either I have 2 gloves on or I don't. So I have to take them off. So say I'm out of the room, right? After I take off my gown and everything, you pull here. Make sure you don't touch. You scrunch it up. And look, I would have my coat, I go under, making sure not to touch. And I go like this. This is in my hand. My hands were already washed. And I throw this outside. Normally I wear 2 gloves, so I'm able to do that. So that goes in the bin. Now, how do I keep my mask? Because, during the period of time, they were saying you have to wear a mask 1-2 weeks. So I knew that was going to happen. So what I bought was a UV box. So it sterilized my stuff. It kills it with UV rays. So if I was exposed, I have one in my office and I have one in my apartment. I also can use it for my phone, my earbuds, toothbrush, everything I can use that for. So that takes 3 to 5 minutes. And that will help me sterilize my stuff. So why is this not working so well? Okay, so let me just focus this a little bit. Okay, there we go. And I also use this a lot in my car. I have one in my car. Make sure if it's hot that doesn't explode. So I bring it in and I bring it out. I bring it in and I bring it out. Masks are very important for COVID. And you have different masks. So this is actually still, let me just help you with this. Trying to get this right. Okay, so you have right here, the UV is still going on here. So the normal mask that you would have when you go out, you see a lot of people, they have the masks that are designer and stuff like that. Now that helps prevent others from not getting what you got. They're not going to protect people in the store who have COVID and they cough. and that mist goes into you with those surgical masks or those do-it-yourself masks. They are really just to be worn so that you don't give what you have to others. The only proven mask that works are these N95. So I'm waiting for this to be sterilized before I take it out. So of course, you know, you do have masks like these, but these will scare the patient. So I would never wear something like this, you know, in the hospital. This is from the military. I was a captain in the U.S. Army Reserves. So yeah, this we use for basic training so that we learn how to breathe in those masks, even though they you go into rooms and it has a lot of toxins. So I'm gonna actually speed this up. UV rays are dangerous, so once I do that, so with this box, this is how I sterilize my mask. And this mask I use for the stores. It's kind of like an N95, but I don't know if it's qualified, you know, really to get those. So this has to be squished, this has to be tight, and you can't have hair. So this all the way up, and this one has to be on the bottom. This will probably protect me more than likely if someone does have COVID, and it's definitely going to protect if I have COVID, not to give it to others. So UV light, this is how this looks. 3 to 5 seconds, plug it in, the UV light comes on. This is what I wear in the hospital. I wear this. Remember, this has to go on first. In the back, go like this. Squish this down in your nose, make sure your glasses should not fog up. If it does, it's wrong. So this goes up, this goes down, and I always wear a shield. I don't have the gowns with me, but I'll show you how a gown looks. So this will go on, and then I can talk to the patient, they can cough, and that protects. I also wear a gown, very important. So I got something new today, very new today, so I'm really excited about it. This is really hard to talk through. Oh, I can't even breathe. Now, like I said, these surgical masks, only good to protect others from you. It will not protect yourself from getting an infection. Has to be squeezed on the nose, it has to go like that. You can't feel the air, you can use a light, but it's not gonna help you not catch something, but it's better than nothing. So today, I got a package in the mail. So this is really exciting. This is a company called O2canada, and they were building this filter, this mask, even before COVID happened, and they were doing it for polluted areas. And I was worried about it because it came from Canada, and it took like 2 months to come. I was praying to God that it did not have a package on it of what would be inside it, because it would be stolen, even though I live in an area that they normally don't steal. But I look at the packaging, it does say O2 curve filter, O2 curve mask. So not good, because you don't want anything that's identifiable, because if someone sees that this is a mask, you know, in crisis times, people do things that normally they would not do, not in a crisis. So let's check this out. So I got this. Let's open it. So this would be the O2. Wow. So this is some extra filters that I got with it. Filters that it came with. Oh, they sent me more filters. That's good. I did tell them I am a healthcare provider. So this is the O2 curve. And the website is O2canada, I guess, .com. Oh, nice. So this is going to be my new mask. I'm not sure if I'm going to wear it in the hospital, but I may. I don't. They say it protects against 0.1 microns. I think the N95s, the green ones, these are the ones I have been using exclusively with patients in the hospital. Must have seen over 100 positive COVID patients, and this is my third or fourth negative. Never really had symptoms. I did have symptoms, but the symptoms were allergies, not related to COVID. So let's go over this. So this is my new filter. Ooh, before I touch it, what? Hand sanitizer. Even though I did UV ray, I am constantly washing my hands with soap and water, alcohol that I made. So let's look at this new filter. Okay, so right here, you can change this because this comes in red, black. They only have the white left. Is there a filter in it? Actually, there's no filter in there. So I would have to read, but of course, most people do not read. I'm not going to make a stereotype and say men really never read the instructions, but I see it has the filter. If you can read that, that's the filter that goes in there. And if you guys want to scan this, I don't know if you can see. Is that right, or I don't know which way. You can scan that if you want. And be careful what you put in your mouth. Okay. Try to open this up. Watch me rip the filter. It's not going to be good. Let's see if I have anything like a knife or anything. Okay, so I got the O2 curve. Let's see how easy it is. So I'm not reading it, but of course I will read it before I. So obviously it doesn't go that way. So it probably goes. Ooh, didn't drop it. I'll try to figure it out, and then I'll read it later. Okay. Now it has actually little prickly things in there that makes it attach, so it's really easy to put in. So that's the filter that goes in, and it fits really nicely. And you clip it on. Nice, because it does have the breathing mechanism. Doing this right? Should click on, and it did. I'm going to make sure it clicks on correctly, and click, click. It is definitely clicked on very well. And this is for the back, and of course your nose will go up there. Wow, nice. Well, this actually will have to go in the back, right? Who is that on? Who is this little girl? Hey, Lola. Wow. Wow, my God. This, it has to be tighter, and I don't really know how to do that, but as I'm breathing in, you can feel the suction as it gets tighter on my face. And when I'm talking, it doesn't hold so I can breathe. I can wear, so this I would probably wear to the store, shopping. I would definitely wear this to the laundromat. Normally I don't do my clothes, but because there's no laundromat open, I have to do them myself. So I really like this. Whoa. So this is the O2 Curve mask. I like it a lot. Where is my shield? Hey. Well, of course, I will not. I still will wear my N95s in the hospital, but this is definitely not tight enough. I have to learn how to tighten it a little bit. And this seems tight. I do not feel like I'm suffocating as I do with the N95. What is this called? This is also N95. This, forget about it. So I could definitely do this. I have a lot of filters. Hopefully it will last me until COVID is gone, but I'll make sure I go online to O2 Curve. You want to do that? And buy some more filters. Two thumbs up. Peace out.